So we want to head now to a virtual press conference meeting that's happening with the South Carolina Department of Public Health. They're talking about measles cases and preventing the spread. Last checked, I know last week we had it here on Live Impact News. There was additional cases in Spartanburg County. Also, Department of Public Health launched a webpage to update the public on outbreaks. Let's take a listen into what's being said right now.
Have seen more and more vaccine hesitancy, more and more vaccine resistance since the COVID pandemic. And not just against the COVID vaccines, but also against vaccines that have been in use, as I've mentioned before, for decades. Another concern in particular about this low coverage in the school districts in the upstate is that they are also have among the highest enrollment in the state. So when we look at those percentage points across other school districts where the enrollment can be lower, the fact that this is a large number of students among the highest enrollment in the state that has lower vaccination coverage is an additional threat to the population in general because of the obvious interaction between those schools and the surrounding community. So that's just an additional concern for that vaccine hesitancy, vaccine resistance. We have seen that, as you mentioned, an increasing trend for years, for the last several years in that part of the state, and that puts us at risk not just for measles, but we continue to see outbreaks of other vaccine preventable diseases in that area of the state as well.
Thank you, Tom. Deidre, go to your question.
Hi, this is Deidre McPhillips with CNN. Thanks so much for keeping the lines of communication open around this outbreak. I was wondering if there are any factors that have been constraining your response. For example, has the community been responsive to questions from epidemiologists in the health department, and have they been respectful of quarantine?
Yes, we are very grateful for the cooperation that we've received from the involved schools in working with us and communicating with their families and their communities and helping us get the word out about the fact that there have been exposures in those school settings. We're also very fortunate in that we have provided guidance to the cases to remain isolated from others while they are infectious, as well as those who are in quarantine to remain in quarantine. And so there is a great benefit to us in preventing spread of the disease by following these effective disease prevention and control measures. And again, we are grateful for that cooperation that we have received so far from those involved.
Thank you. Ray, go ahead with your follow-up, sir.
Hey, Dr. Bell. I noticed that the Global Academy of South Carolina, according to your data, has a 17% vaccination rate, meaning that all the students had all their shots. Fair Forest Elementary had an 85% vaccination rate. Is there a difference that you have seen between vaccination rates in public schools versus private and charter schools? And is there any thing that you all can do as far as limiting the number of religious exemptions that people are allowed to get?
Well, I can encourage those to look at the data that's available. It's not necessarily that we are seeing lower vaccination rates by school type. As I mentioned earlier, this can vary from one school to the next. And the thing that we can do to address that is really exactly what we have been trying to do, is to make everyone aware as quickly as possible about the status of the outbreak in the state so that they're aware of cases occurring, and when cases increase in number, the general area where they're occurring, because again, just knowing a specific location does not mean you're protected. It's important to have awareness that there's transmission in your community. And we continue to promote the effectiveness of the vaccine, because that is really the most effective disease prevention measure that we have to give people immunity before exposures occur. And so those community outreach efforts to provide education, to provide actionable data, and also to provide these vaccination resources, not only through our Department of Public Health, services within our clinics or through our mobile health units, but also making people aware from our website. They can use our vaccine locator to find other locations in pharmacies or other clinics, federally qualified healthcare centers where the vaccine may also be available.
Thank you for that. Tom, you have a follow-up?
I do. Thanks for taking another question. When you look at some of the counties and their immunization rates, even taking into account the religious and medical exemptions, it doesn't account for all the students who are not immunized. In some cases, it's a pretty large number of kids. It's something like almost 3,200 kids in Horry County in the 2024-25 school year. It's almost 16% of kids in Jasper County. So when you have that situation where there's not a medical or religious exemption, but these kids still aren't immunized, what's going on in those counties, those schools?
So the exemptions, I want to make a point clear about the two types of exemptions. Medical exemptions are issued by a healthcare provider and are typically due to a specific reaction or contraindication to receiving a particular vaccine. So for example, a child may have an underlying medical condition that they can't receive a certain vaccine. A medical exemption usually applies to just one vaccine or a handful, whereas medical exemptions is a choice made by parents that generally applies to all of the vaccinations, although sometimes an exemption may temporarily be requested so that they can get their vaccinations on an alternate schedule that is usually not recommended. Now, how those parental choices are being made from one county to the next has more so to do with the parent's choice than something going on in the school. And just one more point, as you brought up Jasper County, I would again acknowledge that while Jasper may have a relatively higher exemption rate, the enrollment of students in Jasper County is much smaller than it is in, say, Greenville, Spartanburg. So again, when you look at those percentage points, you also have to look at the percentage of the total number that we're talking about. And again, this raises our concern in the upstate because of the large number of students enrolled in the upstate region.
Thank you.
Thank you. Christian, go ahead with your question.
Just for clarity, the outbreak initiated at the schools, right? That's the source of the outbreak, not the gym. Is there like just a timeline to understand like when the first case happened and compared to the gym case?
Well, we made public notifications when we identified each of those cases. So there you will have the timeline. And as far as, and similarly for the child that was identified as having been infectious while at the gym. I'm not sure if that answered your question or not.
I think it was just that the kid at the gym happened after the outbreak at the school or beforehand was my question. Are they considered part of the same cluster or is that separate?
Any epidemiologic linkage between the child at the gym and the earlier cases, because we're still investigating that, have not yet been established. But to our knowledge, I am not aware of any connections with the students in those involved schools.
Thank you for
Got
that.
it. Okay.
Eduardo, go ahead with your question, sir.
Thank you. And just rephrasing my question a bit, in West Texas, we saw a Mennonite community where outbreak was first identified earlier this year. We've seen Hasidic communities in New York City a few years back. Is there a specific trend you're seeing in the population affected, or is this more related to the schools themselves?
It's not necessarily related to a specific population here. We are seeing religious exemptions, that choice being made by through parental choice, variety of different individuals.
Thank you. Deidre, go ahead with your question.
Hi, thanks again. I was wondering, you mentioned that you do anticipate more cases being reported. Have you done any modeling, or do you have an estimate as to how large this outbreak could grow to?
So disease modeling is available. We haven't necessarily applied that to our outbreak because one of the reasons is there's a tool on the CDC website that can be used to model. They actually you have to enter a certain at-risk population that we fortunately have not reached that at-risk population yet. However, just from historical knowledge of how the disease is spread, we do know that if you introduce a case of measles into a highly unvaccinated population, that as many as 18 to 20 contacts who are unvaccinated and exposed to a case may develop disease. And another way to look at that is that about 95% of the people who are unvaccinated and exposed to a case.
All right, welcome
will
back here on
develop
Live Impact News on WCNC Plus. I'm Nick Sturdivant.